Zeroing in on what your chronic illness is, what you're trying to achieve with your foods, and then deciding how I'm going to shop. And we talked about the canned vegetables, and primarily when we're looking at these, when I was just doing this the other day, is that as you're reading this label, remember, a thing you can learn is called the 520 rule on a label, and basically what that is this percentage here, if it's 5% it means it's low, and if it's 20% it means it's high. So that's your ballpark figure. So if you look here at sodium and it says 260 milligrams, unless you know how many milligrams you're supposed to eat in a day, that's going to be a meaningless number to you. But if you look over here and it says 11%, that tells you, she said 520. That's smack in the middle. And then the other one, remember, that's only for half a cup. So if you're going to eat this whole can, you're now going to be doubling everything. Making more and more pastas now made out of whole wheat. And when my plate says they want us to have X amount of grains, then half of those grains should be whole grains. Because with your jarred pizza sauces, the only thing you're really looking for there is typically the sodium. And some of them have a high level of fat in them. Sugar. Right, but if you use the 520 rule, and they do have added sugar to them because sugar takes away the tannins, the taste of the tomato. Yeah, that whole acidic flavor. But remember, your sugars divided by 4, and it'll give you a good guideline to see how much is added in.
Do you have a handout to tell you about the 520?
It is in your sack.
Good.
So next time you buy it, you should switch down to this guy only because this one has more of what we call monounsaturates. And what the monounsaturated fats do is they lower your bad cholesterol, but they increase your good cholesterol. Where your vegetable oils do not do that because they could be made from safflower, sunflower, corn, you're not sure. And they don't cost any more, they cost the same. So the number one choice is olive oil. That's got the most of those monounsaturated. And then this is next. So if those are the 2 oils on your shelf and you use them appropriately for what you're preparing, because sometimes olive oil doesn't lend itself. And you can recognize the word sodium on a label. When you're looking at the ingredients, the first word that listed is what's in there the most. So what's the first word? Salt. So when you read that, you're going to put it back. You're going to say, okay, I got to find another one. And you start roaming through all the herbs and spices. Pick out ones that do not have salt listed as that ingredient in there. So it'll either say salt or sodium, some combination of those two words. Because once they put the meats on the pizzas, they're not using a very low fat source. So again, if you can buy it plain, and then you can put your own vegetables on that pizza, and I think you'll start to see more of the whole wheat crust and some of the low fat cheeses on the frozen pizzas now, because it's becoming a big, item, and of course there's a lot of profit.
Have a bowl of vegetables with it
on the side.
Yeah.
So it sounds like you're doing the right thing. Like these kinds of things to make it look like it's the healthiest thing for you. But then when you get down into reading the label, you just want to make sure. It may still be part of a healthy diet, but it may not be exactly what you thought that it was. And that's why that 520 rule comes in handy. It's quick and easy. You don't have to be doing any calculations anymore as you go along. But if you're reasonable and you talk about good portion control, you should be able to live normal lives and enjoy all those foods that everybody else is enjoying.
The tour, did you enjoy it?
We did.
It was very informative.
Do you feel like you know more now than you did when you first came in?
Yes, a lot of things were clarified and some ideas that I hadn't thought of.
Yeah.
Was there anything really unexpected that you learned that stands out to you?
That rye bread is not a diabetic-friendly food that I thought it was. So.
And the salt substitute.
Potassium chloride.
Potassium chloride is not very good for me. I should try for something, a spice that does not have any salt in it, or at least not on the top of the ingredient list. That would be a lot better for me.
For more information, call the Prevention Office at 410-632-0056, or you can visit our website at worcesterhealth.org.